Good evening, learner. Today, I welcome you all in this online session. I am Ms. Pooja More, working as assistant professor in Dr. Vithalda Vicky Patil Foundation's College of Nursing. Today, we discuss about some health paternity issues only. So here I mentioned was one case scenario, that is 55-year-old male has admitted in the ward with the complaint of EMI. After receiving all treatment, his vital signs get stabilized, but showing some anxiousness and stress. So what kind of other measures we have to taken in the consideration for complete recovery of that particular patient? So here is the answer will come. The case has highlights the importance of addressing both physical and the psychological aspect of the cardiac care. Therefore, today we discuss about the topic, that is yoga in the cardiac rehabilitation in perspective of nursing care. So first we discuss about the some introductory part. In that, cardiac rehabilitation help in the improvements of the cardiac health. Second is yoga is supportive, non-pharmacological therapy only. Then the third will be it will be help in the both physical and the psychological recovery. The objectives of today's session is that at the end of session, the learner will be able to define the yoga therapy. Second will be the explain benefit in the cardiac rehabilitation. Third is describing nursing role in perspective of cardiac rehabilitation. So there is some practices we have to follow in the yoga therapy. First is some gentle asanas. Second will be the pranayama and meditations. Third will be the relaxation techniques. And fourth will be the perform some all the techniques and the pranayams under the medical supervision only. Then only we advise patient to do these things in the home-based management. So benefits of yoga for the cardiac patient is that reducing the blood pressure, means maintaining the blood pressure in the cardiac patient, decreasing the stress and anxiety. Third will be improving circulation and oxygenation. Fourth will be enhancing quality of life. As we know that when all vitals are get stabilized, patient will be free of stress and anxiety. So ultimately quality of life will be get better and very good. So now we discuss about some key practices for the rehabilitation. Under that, first is the breath control, that is called as a pranayamas. Controlling breath is the first step in managing the mind and slowing down the elevated respiratory rate which is caused by the stress. Nowadays, many times we see that because of some incidences, some emotional trauma, there will be the imbalance in the vitals. For example, respiratory rate will be get increased, BP range also get increased. For controlling this, if we regularly base doing the breath practices, that is pranayamas, so it will be help in reducing the or maintaining all the vitals of that particular person or the patient. In that, first is Anulom Vilom Pranayam and second will be the Brahmari Pranayam. Both are the types of pranayamas only, but difference is only that one is performing without sound creation and second will be performing with the help of sound creation. As the first image will be showing that Anulom Vilom Pranayam, so it will be help of fingers and the nostril. We have to doing the breathing exercises without creating any sounds. And in Brahmari Pranayam, with the help of thumbs, we have to close the air pieces and doing the breathing. For example, at the time of inhalation, we have to pronounce the word that called as a hmm or om. So it will be ultimately producing vibration in that particular person's body. So it will be helping in controlling the mental peace of that particular person. Second is that gentle movements, nothing but the asanas. So asanas is nothing but the we have to give the some postural postures to the body or some exact position to the body which help for the entire alignment and the blood circulation in the body. The common postures or the practices we have to follow for improving in the CVS patient or the cardiovascular rehabilitation, that is first is Tadasana. The common term for Tadasana is mountain pose. In that vertical stretch we have to do for improving the blood circulation. In children, Tadasana is improve or the useful for the improvement of that particular children's height. Second will be the Vakrasana, nothing but the twisting pose. The gentle spinal twist that help to releasing the tension and the balancing the emotion. Third will be the bridge pose, nothing but the Sutta Padmasana. So in that specially used for the stretching of the muscles and relieving the pain from the specific body part. Fourth is a Shavasana. So it will be relaxation pose essential for this calming of the nervous system, because when we are doing different kind of asanas, it will be increasing pressure on the nervous system. So for relieving the stress on that nervous system, we have to produce or doing the uh, Shavasana in intermittent period of time. Here is the images of four asanas. First image will be showing the Tadasana, nothing but the mountain pose. Second will be the Vakrasana, nothing but the twisted pose. And the third will be the Satya Padmasana, that is bridge pose. And the fourth will be showing the Shavasana pose. Then we look out some another common yoga practices for the improving of the cardiac rehabilitation. In that, the acupressure is one kind of therapy which is cultivated in Indian culture far long back of time. So it is our own things. So we have to practice from childhood to the end of life stage we can perform it. So acupressure nothing but the specific pressure point can be used alongside yoga to provide the immediate relief for the physical discomfort and the stress during the rehabilitation process. So here is some showing the common pressure point when we use for the pressuring that point. So ultimately whatever symptoms present at that particular body side, it will be get reduced. Then here is some common asanas which is useful in the improvement of the heart of health. The first is a pranayama. Second images will be showing the ardha chakrasana. It is nothing but the standing and backwarding the uh, entire upper body posture toward the back side. Third image will be showing the Setu Baddhasana. It will be helping in the balancing the blood pressure. Fourth will be showing a Uttasana, nothing but a standing forward bed. It will be also helping for the maintaining the blood pressure. Fifth image will be showing a Bhujanganasana. It is nothing but the cobra pose. Ultimately, it will be also help in the maintenance of the vitals. And the sixth will be the Dharuvasana. It nothing but the Bahu pose for the strengthening of the heart teaser. And sixth will be showing the Shirsasana, which is for the knee to head forward movement. So all this seven type of asanas help in the improvement of the heart conditions. Then there is a perspective or the specific nursing role or the whatever healthcare team member was there. So what exactly their role in the rehabilitation of the cardiac patient. So among that, the in nursing role, the yoga therapy is applied, and the holistic term itself is that we have to concentrate the person's physical, mental, social and spiritual well-being together. Then only the holistic health of that particular person will be come in the reality. So value-based discipline rather than the just exercises. It means whatever exercises, asanas we told to the patient, it will be should followed in the proper manner or in the proper guidelines only. Otherwise, you know that when the things will be go exceed, it will be showing the adverse effect also. So in the first that the way of life. Ultimately, nurses can lead to the yoga lifestyle, integrating the clinical practice or the ethical principle. For example, when they had mentioned some guidelines for performing the pranayamas. So if we told the patient this is the how we have to maintain the posture, this is way how we have to hold the breath. So ultimately it will be showing the good recovery in the patient health, and ultimately there will be the good improvement in the cardiac health. Second will be the purity of thought. Caregiver should emphasize the patient that physical health is deeply tied and through the purity. It means when the patient having the goodwill, then ultimately their health will be recovered in 101% manner. So whatever person will be think, then that things will be affect on the health or the physical activity. Then the third will be the holistic integration. It means the physical and the psychological both aspect together, then ultimately entire health of that particular person will be get improved. And ultimately when the person will be feel physically and mentally fit, then the daily living activity, connection with the society, their working status, everything will be get balanced, and the person will be able to give 100% output from their side in any sector of life. So here the conclusion of my topic that yoga is effective in the cardiac rehabilitation and entirely in the life for maintaining the holistic health of that particular person. Nurses play a key role in the education and the monitoring. Then the third will be the promote holistic cardiac care. As previously I said, here I mentioned some bibliography aspect as you want to learn about the yoga and the cardiac rehabilitation. So here I just enlisted it. Please go through it. And here is the one article which is recently published. So it will be showing that there is a more than the 50 to 60% improvement in the patient with the cardiac issues if we follow physical psychological aspect together along with the medical treatment. It means both are together, physical and mental aspect, then ultimately the patient holistic health will be get recovered. Thank you so much.